There is clear research to show that biological factors have an influence on emotional and behavioral issues. However, there is clear research to show that biological factors have an impact on emotional and behavioral issues. However, there's also research to show that environmental factors influence behavior as well. As educators, our concern is usually with environmental factors, as our impact with biological factors is extremely limited. The more we learn about genetics, the stronger the argument is that behavior and emotional disabilities are greatly impacted by biological factors. There are many conditions that are linked directly to genetics, for example, schizophrenia, ADHD, anxiety disorders, even some antisocial behaviors. However, the research also shows that those same behaviors and conditions are also influenced by the environment. So therefore, even though people may have a genetic predisposition for certain conditions, the environment can impact whether that person actually develops those conditions or how severe those conditions may be. Most of the time, individuals inherit a predisposition for certain behavioral or mental health issues rather than actually inheriting the condition. Having a predisposition simply means that you have the genetic makeup that puts you more at risk for developing these issues, but it doesn't mean that you necessarily will. Schizophrenia is a good example. It's a mental illness that has a very strong genetic link. However, there are environmental factors that may actually help to lessen your chance of developing schizophrenia or strengthen your chance if you already have the predisposition for this condition. Traumatic brain injury. Students who have experienced a traumatic brain injury may exhibit behavioral and emotional issues. However, this is a separate special education category in the state of Virginia. Although malnutrition and some food allergies and other allergies may impact behavior, it is highly unlikely that they would be the cause of a serious emotional disorder. It is not surprising that temperament plays a large role in the development of emotional or behavioral disorders. However, once again, environmental conditions make a difference. Two children with very similar temperaments may show very different outcomes due to differences in environmental factors. A nurturing environment with clear limits that teaches and reinforces coping skills and management of emotions can have a tremendous influence on how a child with a challenging temperament learns to cope. Although our influence on biological factors is very limited, as educators, we should understand some of these causes so that we can work with other agencies who may be addressing the medical needs of our students. As educators, we should be very careful not to recommend or suggest medical interventions to our students or to their families. The law in Virginia is very clear about educators making educational decisions and medical practitioners making medical decisions. At best, our role should be to share important information with those who may be treating our students medically or to refer parents to doctors regarding their medical questions.